I'm Kim Williams. I'm one of the social workers at the Brown Cancer Center, and I work primarily with breast cancer and gynecological oncology cancer patients. So one of my roles within my social work role is that of sexual health therapist, particularly within those populations, the breast cancer and the gynonc populations. I get a lot of referrals from the physicians in those departments. Sometimes nursing staff, sometimes the patients themselves will call because I have sexual health therapists on my card. So a lot of times they'll call out of curiosity, wondering, kind of what that means, thinking that they might need me. So I work very closely with Carolyn Palmer in gynonc. She runs the sexual health clinic aspect of the gynonc setting and works kind of on the physical end of things, so assessing for vaginal atrophy, types of things like that. She talks to them about vaginal dryness and moisturization, lubrication, vaginal dilators, lots of different things that go along with either the cancer itself having impeded their sexual health, the treatment of, meaning radiation, chemotherapy, if that's the case, and that can impede their sexual health as well. Vaginal dryness is a big one in that setting and in the breast cancer settings because of the cancer and some of the medications that we give. It will send women into early menopause, and of course surgical intervention will do that too. So a lot of times we're talking to women that are younger and have suddenly been thrust into early menopause, and a lot of what that means to them in terms of how their body changes as a result, how their libido changes, their desire drops as a loss of estrogen, which is basically what we do to them with some of the medications and with putting them in menopause. So there's a lot of physical changes, but there's also a lot of emotional and mental changes that impact their sexual health and that of their partners. So from my end, I can meet with the women one-on-one to discuss some of these things, and if need be, we can pull in a partner to help them understand, because it's really hard for the partners of these women to understand what's going on too. So we do a lot of that type of thing, a lot of education. And what I find is a lot of times it's just the education and the information can go a long way, especially if that's done on the front end and early. And if that doesn't do it, or if that gets missed kind of on the back end, sometimes it is more of an issue because you've desire discrepancy is a problem in some of these relationships. And if the sex is painful, a woman doesn't want to do that, and so there begins to be this avoidance, and then that's where it's really kind of can wreak havoc on a relationship. So that's where I can step in pretty much at any point that's what we're trying to avoid, is relationship issues down the road, and sexual health issues for that woman at any point in life. So one of the things is if a patient knows that that's something that's going to happen, and I know when the pharmacists and nurses do the education that they mention that they say, one of the side effects is vaginal dryness, but it's at a time when they're getting so much information, and I don't know that always translates into painful sex. So just to make sure that you mention it and not be ashamed to bring that up and to say those words, because patients a lot of times are embarrassed and they don't want to bring that up. And so it's kind of on us as the medical professionals, whether it's their doctor, their nurse, or infusion nurse, or whoever it may be, to just ask. And if they say, yeah, that is something, you can refer them to me, or they're over-the-counter vaginal moisturizers that are available at Walgreens, Target, whatever. Riplens is a big one, and it's just a simple, I always give the analogy to women. It's like, when you wash your face, you soap and water and wash your face, and you always put moisturizer on, because if not, you get that dry, your face starts to sort of get that tissuey feeling, and the same thing happens to your vagina, unfortunately, if it's not getting regular moisturization. So if your body's not doing that naturally, you can supplement that by some over-the-counter things that do not have estrogen in them to help with that. So it's on the front end, usually it's a kind of a simple fix, but it's when it's left to go, it becomes an issue and a problem, and can really cause problems in relationships. But so I guess I would say, to that person, to just not be afraid to ask that question, to say, if it's a woman that you're working with, a lot of patients tell us that they have this issue. You ever have that issue? Is that something? And women may be surprised that, that you asked, and relieved that you asked.